Hi everybody, my name is Alex Rodriguez and this is my speech for communication. Today I'm going to show you guys and explain you guys what a spiro is. So what is a spiro? A spiro is a function long test that is going to help us to diagnose diseases and treatment for these diseases. According to the American Lung Association, the spiro is a common breathing test that is basically going to measure how quick and fast you can inhale, exhale, and then hold air for a second. This way we can see how your lungs are working, and this way we can prevent, treat, and diagnose asthma and COPD. The importance of performing a spirometry or a spiro, which is a breathing test, is crucial because it helps to diagnose, like we said before, asthma and COPD. Also, it can help us to assess how the treatment is working once we start with the treatment and therapy. This is going to help us to see if it's working or not, if we are giving the patient the right dose or not. And lastly, Kat Lay mentions in her article, millions of teenagers in Africa have undiagnosed asthma. That's her article, and she mentions in that article that the breathing test, the spiro, can actually help the doctors to see how quick it's changing, how quick the disease is changing, and how it's evolving inside our bodies. And again, this is very important to know because asthma, especially asthma, COPD as well, but especially asthma, is a very concerned disease and condition that is affecting actually a lot of young people between 12 and 17 years old. About 9.9% only in the United States of America of teenagers around this age have actually asthma. And this is affecting their lives. And this is actually only in young people. Usually is the sector in ages that is more effective. Adults and younger people before the 12 years old, they don't have high risk of asthma. So this chronic disease can actually lead to missed day of school, can actually lead to have trouble doing physical activity and trouble playing with their friends and stuff like that because they're gonna run out of breath, shortness of breath, and of course they're gonna end up going to the emergency room more often, and it's gonna affect their lives overall. So now I'm gonna show you guys how to do the breathing test, okay? So I prepared the machine already, all the information is there, that's the first step that you have to do. And now, I explained my patient already what we're gonna do. We're gonna inhale first, exhale after, and these gloves are not working very well. No, Lisa, wait, right? That part is not there. Alright. Now I put the mouthpiece in there. So I'm gonna hand it to her. Alright. You can stand now. Now you can put the tip inside your mouth. Inhale. Exhale. Yeah, that's it. In conclusion, after showing you how to use the spirometry and after giving you the rates and the high percentage of people having asthma in America, understanding and performing a spirometry is very, very important to diagnose asthma and another chronic disease on time and early, because that way it's going to be easier to manage the treatment, to manage the therapy, and of course, to prevent to get the disease getting worse and worse. So this way, a spirometry can lead to better management, better outcome, better life, and of course, very enhanced quality to those affected, okay? Thank you.